All right, I think we should get started. So let me just take a minute to welcome everybody to this special seminar series on data science for the COVID-19 problem. As all of you know, data science is of use of value in essentially every discipline across our university. And the many disciplines that bring value to addressing different aspects of our current pandemic are no exception. And so we find data science at the forefront of addressing these issues. And so to highlight this, we're kicking off a seminar series as well as a set of mini workshops that dig into a few of the topics in a little more detail. And you'll find information about all of this on the MIDAS webpage. But today, I'm delighted to have our seminar series kicked off with a presentation by Professor Siqian Shen from the Department of Industrial and Operations Engineering. The next talk is next week by Professor Brahma Mukherjee of the Department of Biostatistics. So Professor Shen has been an active affiliate member of MIDAS. She's also an associate director of the Michigan Institute for Computational Discovery and Engineering. She got her bachelor's degree from Tsinghua, her PhD from the University of Florida. She's won a number of honors, including the DOE Early Career Award and IBM Smarter Planet Innovation Faculty Award. She works in the area of optimization primarily and risk analysis. And when the COVID-19 pandemic hit the world, she realized that there were many logistical challenges that the work that she had been doing and others in her field would be of importance, as so many people struggle to put various systems together under very stressful conditions. And we're delighted that she's taking the time to tell us something about that today. So, Siqian Shen, please take it away.
For the invitation, for having me here. And so today I'm going to, as Jack says, I'm going to show some of the things that has been done, in particular in the area of operations research, industrial engineering, system engineering, and see, anything that, we can push them further to address some COVID-19 related issues. So I'm going to share my screen now, so that you can see my slides, and I'm going to start it. So during the presentation, if any of you have any questions, because I think I'm in the sort of like a full screen version, I couldn't see you either nod your head or raise your hand. So please enter your questions in the chat. And then at the end of the talk, I'm going to go through the chat and read off the questions and answer them. So that will be something that we will try to do during this talk. All right. All right. So yeah. So as I said, sort of like this is basically today I'm going to give a very technical light talk. Basically, we're not going to dive into the details of the the techniques and so on and so forth for specific problems, but it's more like like we try to cover as many aspects of COVID-19 related issues as possible and try to present some tools and models we have out there. And the outline of my talk is the following. I will first start with some overall lessons, like why motivate us to think about these problems. And then basically we try to put into problems by categories. So the problems that very necessary to address during the disease prevention phase versus if your disease already had an outbreak and how we control them. And as you can see, there are many different parts that we can, kind of think about as system engineers and then try to, find ways to improve the current situation. And then, like hopefully as the disease comes down, we will need to also deal with some other issues in the recovery and post-recovery planning phase and with the conclusion. So one thing I'd like to mention is that my talk is basically based on this sort of like a document I have also put it on my website. This is a developing document. So, if you have other reference or any other papers that are addressing similar issues that I didn't include in my talk, welcome to send me an email and I can include into this summary document. And before I start, I just want to thank you all the people who gave me help, especially these PhD students that they have their own project to work on, but at the same time, they just devote their time to help me collecting some reference and making the slides. So thank my formal and current PhD student. In fact, a lot of formal PhD students gave a lot of help as well because they are working in the very front line as research scientists in Google and Amazon, and they have a lot of real world problems they're addressing daily right now. So they gave me a lot of ideas. All right, so this is a picture by McKenzie. And basically this picture date is pretty outdated as we can see now. It's more than a month ago. And that was the time that when, the disease virus kind of jumps out of China and starts spreading out of the whole world. And as you can see back then, United States is not really seen as a big problem back then. It only has 1,678 infected cases, but we know how bad it is now. So I think, you can see how quickly this disease spread out, definitely from this picture. But one thing I would like to mention is that in this picture, it reflects, different countries that can be at different stages in terms of the disease outbreak. And normally you can think of them as, if you are in stage 1, those have sort of small numbers of cases identified, not of local transmission observed yet. And then, and as, time goes, if we didn't do well in terms of controlling disease, it can get worse and it can get into these, stage 2, 3, 4. And stage 5 basically represent this recovery phase that the disease is almost under control. And then, but then you still see some new cases appears. For instance, China has been in that stage for quite a while right now. And we can talk about, what other problems they are facing right now in terms of being even in stage 5. So I want to kind of show this picture just to, emphasize that if you want to look at a problem, you need to first examine what stage you are in because the problems are very different depending on the stages and the virus outbreak situation. So before I start with the, the modeling part, I want to emphasize first, what data science can help us, right? So even you don't want to make any decision at this moment, you just want to see what our systems looks like at this moment. There are a lot of things can be done using machine learning data analytics tools. So I gave you a few examples, this kind of picture is being drawn using a lot of tools behind it. So for instance, you can kind of see the trajectory of the disease, the confirmed cases in different countries, how they evolve and so on and so forth. And it can guide you through a few, decision-making process later. If you want to kind of figure out a more detailed sort of setting, you can see that back then when I was updating this slide, so that was April 2nd, that's the date. And you can quickly see that, United States spend are in the sort of increasing mode at that moment. As a comparison, South Korea and China has already been quiet a little bit. So that kind of gave us a little more information. Again, there are many things you can do So one thing that, people have come up with, and that's something example I find online, and I believe that was a talk actually given a few weeks ago through MIDAS as well. So Michigan researcher also, think about how we can predict the disease trajectory, especially for instance, in Michigan or in county. It doesn't have to be a country level. So one observation we have from the past data before is that, there is some, kind of like patterns, and in some cases we call them exponential growth. So if we know that's sort of like the trend based on the current data, then we can sort of like predict the future, right? And then that's exactly, if you go to this website developed by Michigan researchers, you can find some more results over there regarding the prediction part. And if you dig into it, it's not only about prediction of how many confirmed cases, we can even divide it by, the zip code they live in, the demographics of the population, and so on and so forth, okay? So in this talk, I would like to focus on the other side, which is if you have the prediction function and also some tools that you can use to know what the future data may look like, even they still have some certain uncertainties, can we put them into actions? So, so basically, I would like to change from the data part to the action part, and then to the solution part. We have been talking about flattening the curve, again and again. So what we can really do in order to flatten the curve, and what's the mathematical models behind them. In particular, I would like to put them into prevention, intervention, control, and recovery phases. And then because my background is in IOE, so I can only be sort of like giving you more information about OR and then industrial engineering, IE tools. But like different domains, as Jack was mentioning at the beginning, are trying their best to use their domain knowledge to help the very emerging situation right now. So in the prevention phase, the first thing I would like to mention is testing. So definitely testing is very, very important. It actually, like later we will see that a lot of good examples about if you do testing well, you can, kind of like detect the disease in a very early phase and hopefully control it. So this testing can be started even we see the outbreak happens. So in the ideal case that, if you predict that the new season is coming, the new wave is coming, how we can actually allocate our testing facilities. That's one question. And for that, in our domain, basically, there is a very well-known traditional problem called facility location problem, FLP. That has used to be, kind of help the retailer to solve their supply chain problems. So they need to know where to locate their, kind of like manufacturing plants, and also how to allocate their retail warehouses, the retailer stores, and so on and so forth. And the goal here is that can we use this location to satisfy the demand spread out everywhere. And I do not know exactly what the demand will be, but I have a prediction, just like the case that we have for the COVID-19 case. And then, in addition to the location design, you also need to ship the testing kit from your production facilities to the testing facilities, and then from testing facilities to labs. So there's a lot of like a shipment design as well. You have to, kind of like operating a database. So for this type of problem, the objective here usually will be, minimizing the total cost. If you talk about the context we're facing here, the cost will be how convenient it is for local people to travel to the design facility locations. So you can sort of like try to see the ways that they can, kind of like travel, or just the total distance for them to go to these facilities. Also, you want to take into account the cost of shipping as well for the test kits. So overall speaking, it's a long-term process, but then you have to make the decision now and you operate over time. Okay, so this is the model that usually people have formulated for this type of problem. And in this model, basically, the key here is for most of the ORIE models, we try to use linear constraints because then you can have a lot of algorithm for solving them. It can be mixed variables, so you can have some continuous variables representing your shipping decision. But if you want to say, okay, where do I locate my facilities? Those are 0-1 binary decisions. So you have to deal with some sort of what we call mixed integer linear programming model, which usually are NP hard. So there are some solvers developed for that purpose and solving them efficiently. So then this is a real world example. In fact, Singapore has done some models in terms of, deciding their testing facilities. And we all know that they didn't have a very bad, disease outbreak before, but still, if you log online, you can find the nearby, confined facilities you can get test. And also they show you how many units are still available in those, like the testing kits are still available in those facilities. So then you can choose the nearby one to go. So these kind of information, I feel if we can get them in place as early as possible, that the public see them, it will maximally reduce the chaos we may have later. And then, as I said, like if you want to build a mathematical model, normally there are several questions we need to ask ourselves in order to build the model I just showed you. What we know about it, the situation. So in this case, the situation is we would like to build facilities. And so we need to know the potential number of infected cases, population density, characteristics, and also, like the travel distance from the manufacturers, individuals to potential facilities. What we're trying to decide here is those binary decisions that I just show you as the X variable, so where to locate. And the options are, you have all these CVS Walmart parking lot that you can use. So then they will be associated with binary variables to be integrated into your model. And the testing capacity also, sometimes that's a decision variable we'll have to make. And also the shipment volume. The goals here, we can maximize the total shipment cost, minimize the total shipment cost or maximize the travel convenience. So I would like to, show you one reference that's kind of like a textbook, very well cited in this domain area, talking about network design, facility location design, a lot of other things that has been used widely in retailing, but now you can think about in terms of the designing for the COVID-19 case. And again, I would like to emphasize that how important testing is by giving you an example about Singapore. The information is very, very transparent. If you need to testing, starting from the very beginning, you can find it nearby locations and so on and so forth. And then if you extend this model a little bit, right? So the model I was showing you doesn't have this index T. And what that index means here is that you have multiple time periods to make the decision. So you can think about your decision is not only made once, but then you need to periodically re-examine your decision and decide whether there's any new facility I need to open or any facility I need to close if you are in a much good shape. So then, we call this facility location, but then you normally, if you want to extend it to a multi-stage case, you need to incorporate this uncertainty. So this is sort of like a time series model about the demand that you will have. And the demand is highly relevant to the infectious status that you will see. Basically using the data prediction about how the COVID-19 is going to, spread. And then you can use that to predict the testing demand and use that testing demand to feed into this model to decide the best strategy for, sequentially allocate facilities. So that's some other things that we can think about. Not only that, we can even, locating the key hospitals. Like if we want to direct the public to certain hospitals instead of, sort of like all kinds of hospitals, then what would be the ones that, we should try to locate, and also prepare enough PPEs in those hospitals. So these all can be done in the prevention phase, but as you see here, I'm mentioning again in the outbreak phase because this decision just needs to be done so often and so periodically. So then, in terms of the testing, the key is how can we increasing the testing ability. And to me, that's not only, like the number of testing we can do. I think it involves a lot of like systemic ways and then, strategies that we can implement even with limited testing we have. And then the example is again, sort of like for countries like South Korea and Singapore, they are so small so that they can say, okay, we just like do a massive testing and make sure everyone gets the test. In the United States, we're not even near that. So then, to think about testing as a more sort of like a system engineering problem, and design testing more effectively rather than, sort of like a widespread. I think that's also the key that we need to think about here. So I'm citing, sort of like some literature about, confirming that testing is central to the disease outbreak response, and it will help you to detect early and minimize further spread. So I cannot emphasize, how important testing is. I would like to move on to another problem now, but then there are actually a lot of models related to testing that I could not cover in my slides, but you're welcome to examine my my online document and give me some comments. So the other part is, if we see the disease already outspread, then we need to make this decision, right, which is lockdown. So the lockdown can be done sequentially. It can be done by different types of facilities that we would like to close, just like what we're doing now, reopen the economy. We can also do it sequentially by reopen, each part, but not all of them together. So then, like this chart tells you different types of events, activities, what's their chance of getting, disease spread out, and so on and so forth. So basically, the idea here is that these chances, and what's the existing activities out there. The question is how much you can afford in terms of locking down. So you have certain budget, like, not, if at the very beginning, if the situation is really bad, you probably just should lock down everything. So then this was the prevention versus intervention idea. You can do the planning much earlier, so that when you have to react to it, you can quickly commit to your policy before, or you can do it dynamically as you go. And as you can see, this is a picture of New York City locking down. All right, so to build a lockdown model, we ask ourselves what data we have, what decision we need to make, and what are the goals, right? And then as you can see, there are many ways to characterize the problem. One way I present here is a very sort of like a static way and a naive way, but I think it starts the model right away. So basically you have these locations and facilities or the activities. The frequency, how people visit them and how important they are to people's daily life by some number. And then we need to decide which one to close with certain budget. And then what are the goals here is definitely, minimizing the total infections and the inconvenience of if caused by lockdown, and also the economy impact. So very quickly, you can build some sort of like we call knapsack model. So the idea of a knapsack is you have a bag, and you have many items that you can select and put in the bag. Each item has their value, but at the same time, the bag has their own capacity. So how you can actually select a subset of item, in this case, a subset of lockdown facilities, such that within this capacity, you maximize the value of all the items you select. And this case can be even more complicated because we have this probability. So locking down something doesn't necessarily say 100% you will, reduce the infection by so much, right? So there is certain probability about, if I jointly lock down one facility and the other facility, and then, because they're overlap, there are many populations going to these facilities have their overlap. The total probability will need to be calculated in terms of the total reduction of the infection. So I direct you to this paper that we published actually quite early ago about this, how can we design this lockdown strategy in the disease prevention phase and the intervention phase. And that was a paper done by my former PhD student and a collaborator who actually graduated from Michigan. And so then, like we can also think about, individual quarantine model as some sort of like a graph as well. So we can, the question here is maybe you have a network, social network. There are certain people in the social network are very highly contagious, or if they get infected. And so the question here is, if I need to, kind of like protect a certain groups or quarantine certain groups, who are the ones I need to, kind of like take action on. And then the idea here, you can kind of like look at something like this. So we did some modeling for disconnecting a network. So if your network looks like this, if I give you a budget, say you can delete one node from this network, which node you will delete in order to maximally disconnect the network? And you can kind of pre-quantify as what do you mean by disconnection. So here, our definition of the disconnection is that you will result in the maximum number of components. So for instance, if you delete this black node, you will see that these parties are still connected, so they are one component, but these three guys are disconnected, so there are three components. So you have four components as a result. Instead, if you delete this node, gray node, then everybody's still connected somehow, right? So then in this way, you still have only one component still. So the question here is, what's a strategy to do this kind of like, you know, quarantine or interdiction or isolation problem? Normally you would think, why don't we just do a greedy way, which is counting how many connections every node has. For the maximum connection node, I delete them. And this picture already shows you that's not going to be working for some cases like this. So then in this case, we need to build a model, basically solve the problem and try to find what would be the best way to quarantine. But of course, you may have multiple budgets, not rather than blocking one node, you can block multiple. And then the same question you can use for deciding your treatment plan. If you have certain groups that all need some sort of like a special treatment, meaning that, for instance, you can allocate additional facility in those communities and making sure that these people in those communities can get treatment as fast as possible, where are you going to locate them? And then the same graph you can do basically for the quarantine can be used for treatment, okay? And then there was some other models we did before, sort of like saying your cleaning strategy. So for instance, if you have a network, there are some, you know, kind of like node already being kind of like contagious, you can put some cleaning agent in the network. And then basically these cleaning agent will chase these node. And then the virus will kind of like spread out, but at the same time, your cleaning agent will be spreading out as well. And you can define certain rules how they clean. For instance, if they both arrive at the same node, then the virus will get cleaned. And then that way you can sort of like map your whole place as some sort of like a network and try to use some formulation like this to decide the best cleaning strategies. Okay. So these are talking about the testing, lockdown, quarantine. One big problem that we are facing in the COVID-19 related problems are healthcare systems overwhelming, right? And of course, you know, like how can we reform our health systems, make it resilient, and also like improve our daily operations so that we can reduce the infection? That's a key issue. And even without COVID-19, this has been done in the health system for quite a while. So I can show you some problems that, you know, like ORIE people have been thinking about in terms of the healthcare operations management. So the issue here is, as you can see, for COVID-19 specifically, is the high demand we have under very tight resource that we see in a very short amount of time. So it's kind of like a big peak that you see in the demand in terms of the health systems facility resource need. And then the goal here also is how can we avoid overcrowdedness and cross-infections? So there are many things people have been thinking about. For the ICU bed, if you have many people waiting for ICU bed, how can you allocate them? For even like patient admission part, how do I admit patient and triage them so that I can minimize the cross-infection? How do we plan staff members, and how do we dispatch ambulances? And again, you know, these are very small snapshot about the whole picture. So there are a lot of like healthcare problems, in fact, we need to deal with these days. This was, I put out the slides about a month ago. So I actually pull out the one of the picture shown by a newspaper that when the virus was initially started in United States, they actually claim in the newspaper that United States should be fine with the virus, because if you look at the ICU bed per number of people each country has, United States is leading the world. So even Germany is lower than United States. And then we all know that even the situation in Europe was pretty bad. Germany was kind of like a much better situation than the rest of the countries in Europe. So that was very optimistic. But then the question here is that can we just use this figure to say we're fine with the ICU beds? And so that's fine with, you know, like the high number of critical symptoms patient that we see in COVID-19's case. What's not reflected in the figure is that how much imbalance we actually have in terms of healthcare resource allocation in different states and different counties, right? And also some places like New York City, it has a very high population density. And then the normal ICU bed demand probably is already pretty high here. And then so you can't really allocate extra. And also the extremely high healthcare costs and some ICU costs in the US. So those are the other factors that are causing the problem these days, as we can see. So for the ICU bed, so I will mention the ICU bed problem a bit later. So if you think about the whole healthcare system, the first part starts from people come and say, I need to check in myself. And at that moment, you have different types of patients. Their conditions are very different. So how can you do the triage and admission control a little bit better? So what we need to decide here is prioritize these patients to be tested and admitted, and also triage them into different departments and assign appropriate shifts to doctors and nurses. So when we do these decisions, we hope that these can be integrated into our objective. So patient safety, operational efficiency, and also the risk that the healthcare providers are exposed to infectious patients. So as you can see, using some mathematical models already, we have this some sort of like guideline in terms of how do you triage patients as a flow chart. And basically, these are all done, like behind the scene, they're all like math models deriving them. And I show you one example that has been done actually by Michigan people. So this is a very well-cited paper talking about, how do you prioritize patients? And this is not for COVID-19, just like in general, there's some certain type of patient arrival. So you can look at this as sort of like a queuing theorem system. So like a hospital or bank, there's so many kind of systems that you can model this way. You have multiple queues arrival, you just need to triage them, making some decisions, and eventually they will become flows into different departments in the system. So you can write some sort of like stochastic processes to guide the decision, okay? If you make it more complicated, you can integrate more sort of like decisions and also the complication of the departments into your setting. So originally there was a paper 2005, which popular one, talking about that we should use this typical 5-level triage system. So the authors in this paper propose a new way to design the triage and use a lot of like test instance real data to show that they're more effective. Okay. And then, like the ICU bed I was talking about, there are a lot of like departments in the hospital, not the only ICU, but then other departments needs allocation of resources, meaning the beds that you have, and then doctors and nurses. So as you can see during the COVID-19, like a hospital is very overwhelmed. A lot of like beds are actually in the hallway. So how can we better design these ICU's capacities? And there are many ways you can do. You can convert one single room to doubles. So you can discharge some patient who doesn't need the care anymore. So then that decision is also critical, as the same as the triage decision. Now you need to triage them to some lower priority department in the hospital. And you also need to reduce the admission for the non-COVID-19 cases who doesn't have to come to the hospital anymore for their regular check and things like that. You need to decide that carefully, and also define how to allocate scarce technology and resources and provide training to healthcare workers. So all these can be done using some models to guide the decision. So I mentioned one as an example to you. This is a very recent paper coming out to one of our sort of like a flagship journal called Operations Research. So the paper says allocation of intensive so ICU beds in high demand. And so the idea is that they model this whole process as some sort of like a Markov chain, Markov decision processes, and make decisions along the way. So you have actions, and then your actions can cause the transitions of the states and so on and so forth. Okay. The other big part of the problem here is the dispatching of the ambulance. Again, like you have many stocking different facilities, and basically you need to send them out to cover demand. But the demand is arriving randomly, so you don't really know next minute what kind of call you're going to get, right? So in this case, there is a series of literature done by, Professor Laura Albert, who is an expert of, like ambulance dispatch in Wisconsin. And then basically it's talking about, how can you design the coverage model as well as a real-time model. And then the commonly used approach is called mixed integer programming formulation. So as you can see here, still everything, the constraints you have in terms of how many ambulance you have and so on and so forth. And then the flow balance constraint can all be written down as linear constraint, but then you may have the integer variables, meaning how to dispatch them. And then these kind of models can be solved very well in the off-the-shelf like commercial softwares. Okay. The other kind of problems in healthcare related domain is this telemedicine service scheduling that arise pretty much during the COVID-19 case, because many patients cannot visit the hospital. They need to, like talk to their doctors online, and the doctors has certain time limit. So they can only do the shifts like off the duty. And then they tell you like what time I can do it. And then you basically need to put them into schedule, right? So this is a very well established scheduling problem down in the literature for industrial engineering. But then it just like has a new use today for this telemedicine service. All right. Some other things we can think about is for some of the elderlies, we may send nurses and to their home to treat them rather than having them come to the hospital and get infected, because cross-infection has been observed as a big problem in the early time in Wuhan when the disease first outbreak. Many people actually get infected when they wait in the hospital. So then, sort of like these medical home care delivery problem can be think about. So the essential idea here is that you know that you have many healthcare providers information, so where they are, what's their expertise, what kind of patient they can cover. You also have the location of the patients. What we need to decide is how do you match the providers with the patient, as well as telling them the route that they need to do every day. So then, like you would tell the patient when some people arrive their home, and you would tell the providers like how do you, what's the sequence you visit the patients. And as I'm describing this problem, it's already to you seems very similar to this, kind of like a post-delivery or UPS problem. And that's exactly, kind of like what has been done in the literature in terms of the modeling. Vehicle routing problem, VRP, and matching, they're very well-known problems, in terms of finding, kind of like route schedules for, delivery. You can have like one depot or multiple vehicles, and so on and so forth. And the basic model is very simple, but you can add more things like time windows and everything to this model. And then, you can use similar ideas to design this medical home care delivery. So I think the supply chain is also a big area that people have been, kind of worried about and mentioning about for the COVID-19, impact. So the supply chain problem is very challenging because we have seen very abnormal demand patterns these days. And then for the sort of like a overall view, you can look at this book. It's a very sort of like a well-known, well-cited book in supply chain management. It talks about supply chain risk management as well for this kind of a situation. And the whole idea here, I would like to give sort of like a quick snapshot about the bigger picture is why the supply chain is so, kind of fluctuating these days is because some effect people observe in the supply chain called Bullwhip Effect. So if you don't do anything, and suppose that you look at your whole supply chain from the customer side to the manufacturer side, if there is a small, kind of turbulence in the customer side, it will get amplified towards the end. So your manufacturer will order much more if they see a small jump in the customer order. And then the same, if the customer has a little bit drop, then your manufacturer, in fact, will decide their production plan in a much bigger sense in terms of reduction in the plan. So this is just some sort of like a phenomenon that people observe, and then people have been thinking about how can we, kind of avoid this bullwhip effect. And there's a notion called the safety stock, and a lot of things being introduced in order to prevent that, like people just get panic and then, sort of like make their decision very unnecessary. So using this observation basically motivates a lot of research in the supply chain area. And I put two out there just as an example. Something that we do is how can we jointly make location, design, and the inventory decision together to mitigate the supply chain risk. And also some other things you can think about is introducing this uncertainty tool model and design a more robust model. And the idea here is that you can do some risk pooling. So if you only have one supplier, if that supplier gets some problem, then you may see a big failure in your system. So the idea is, can we actually have a hierarchical order of the supplier I go to? And then basically you will have a central supplier and the secondary and maybe third supplier. And then for the secondary and third, basically, the purpose is maintaining well relationship with them so that if you have some back orders, that you can quickly react to it. Okay. But again, supply chain is a big domain, and these days it also gets evolved into this online retailing problem more, because we have more e-commerce. And as you can see here now, the supply chain problem gets integrated with this vehicle routing problem I talked before, because not only people will shop, they will also ask you to deliver. So you have to design a delivery system as well as your supply chain inventory problem together. So that becomes a even more challenging problem. And as you can see, many retailers are failing this test right now because just we can't respond to that big surge in the online retailing these days. And again, for the time's sake, I'm not going to go the details how you design this type of model. But as I said, there are literatures talking about the modeling part, and then eventually there are two big problems we need to solve. One is, how do we control the inventory inside the store, and also how do we deliver them to the customer using some vehicle routing problem I talked about before. Okay. Airline is also facing a big challenge to operate their system these days, given the COVID-19. And for airline management and airport screening, again, we have some models established before for different purposes, and now we can re-examine them and try to make them work for COVID-19's case. So I'm showing you basically, this picture shows you the decline of the trips of the airline phase these days, and they have to basically adapt to everything they have to this decline of the trip. So rearrange all their flights and everything. And this picture shows you that what's going on in the airport, I think it's Dallas airport, when the US announced this US EU travel ban. So that day, basically everyone trying to kind of like flew back to the US, but the airport didn't get prepared in terms of how they should implementing a different screening strategy, so that everyone's stuck in the airport for many hours. And because of that, you can see that there's no social distance here. There's no one wearing any mask here except some sick people probably. So then, sort of like you are getting exposed to the virus in a very high risk. So can we actually have these policies in place before we make the actions? That's something I think we should think about. So for the airline fleet management, there are many questions the airline needs to solve in a daily routine base. So how do they put their schedules depending on demand between different cities? And also once they have the schedule, for each schedule, they need to use different types of airplane depending on how big size, small size of the fleet can work, right? So and then once in a while, they need to pull the aircraft out for maintenance. And so how they should decide that schedule. And also for every flight, they need to put crew scheduling, and then they need to control the OD pairs of their whole network. So the typical way that, like the research has been going is to design this sort of like very sophisticated, again, they're integer programming models with linear constraint to solve this large size airline scheduling problem. And because the size of this, there are many algorithms called like column generation approach, and a lot of things has been developed for speeding up the computation of this algorithm. Okay, so then also for the airline staffing call center staffing, there has been a kind of like a wide research being developed for this type of problem. The main theory is called queuing theory, and then basically it's for handling large volume of calls, which is frequently happen these days. The screening I was talking about, there has been some research done in terms of a multi-level passenger screen. The idea here is basically, the result of that is actually this. So the paper was published in 2006, and that was like after 9/11. And then people have been complaining about they have to go through the whole process, even, you know, like the chance of catching the terrorist attacker are pretty low. So then, you know, how can we actually prioritize people? And then as you can see today, we have this TSA pre-check that, you know, you get pre-checked so that you can go faster in the airport. And then, you know, some sort of like these, the CLEAR program. So they're all sort of like a result of this multi-level passenger screening approach, which can be actually done also in the COVID-19 case when we need to screen people later for possible infections. I just want to mention one thing, that all the models I was discussing, I think there is a big use of them in the low income and underserved communities. And as you can see today, there are people who need the help the most these days, you know, ranging from a variety of things. And then so basically, we can think about, for instance, I'm happy to learn that another public school has this food distribution plan to satisfy kids who had free lunch at school, but now because the school is not open, so that they can get healthy food at home. So what happened is that the school still cook food every day, and then they have the school bus to deliver them to the people who needs them. But then, you know, behind it, you need you know, mathematical model basically telling you how can you design the bus routes and everything, because all the food has to be delivered in certain location for people to pick up during the lunchtime. So the time window is very narrow, and you still have to design enough routes to cover that. So that's a very challenging problem, and they have something down behind the scene. And I have talked to them. They have done pretty well. But on the other hand, I don't think many public schools in the United States can do that. So that would be something that we can do, put online, and then sort of like this, that they can use it for free. Okay. The last part, I would like to quickly mention a lot of questions we need to also think about when we are in the recovery and post-recovery phase. And that's a lot of problems that actually, if you read the news, that's what China is facing right now. So how to continue allocate the essential hospital resources in that phase is very important. And also you need to track the reinfected patients, and most of them actually have no symptoms for COVID-19. And then how to continue to perform multiple level passenger screening, hospitals and airports and so on and so forth. How do you control the inbound flights from different countries who may still be not in the recovery phase? So these days, there's a lot of issues with the airline scheduling and everything in China, just because a lot of people fly back. But then, you know, they are coming from countries with a high infectious status. So then, you know, they may increase the surge again. So how do you gradually unlock facilities, schools, and events, and how to adapt to new customer behavior and travel behavior in your normal supply chain models? And these are all valid questions and important questions to ask. And the conclusion is we don't have to invent something new. In fact, a lot of research related to this facility location queuing problem, integer programming, vehicle routing that I have been talking about in this talk can be modified and solve some of these problems. Okay. So with that, I would like to conclude my talk. As I said, I put this talk a month ago, so it's still there. This is a snapshot of the WHO sort of like Twitter account. Says that it took 67 days for the first reported case to reach the first 100K case. And then the next 100K case was reached 11 days, and then the next one was 4 days. And that was dated March 23. And we all know that, in fact, worldwide we have almost 3 million infected cases and about 210,000 death cases. And about a third of them is actually in the United States. So it's very hard to read, but then I feel like there is a lot of lessons we can learn from other countries, even from the research we have done before, even not at the scale that we're facing right now, and we should utilize them. Policymakers should really utilizing this approach that scientists has already been developed for years to fight the disease. So with that, thanks for listening to my talk. And then if you have any suggestions about other tools I didn't cover, please send me an email and I'm happy to include it in my document. Thank you. and I can take questions. For now, you can either use the chat or you can just, like unmute yourself and ask. Either one is fine for me.
So, well, we give Siqian a minute to catch her breath. That was a really very nice talk, Siqian. You covered a lot of ground and gave those of us who are not experts in your field a very nice overview of the many different places that OR techniques can be useful in addressing the COVID crisis. So thank you for that. And I wanted people to go ahead and put questions in chat if they have any, or to just
yeah, so if someone can help me, that would be nice, because I couldn't find the chat on my screen. If there's already a question there.
There isn't any question yet. Oh, here, the first question has just been posted on chat.
Yeah,
have you used n-person game theory concepts for COVID-19?
Yeah, so myself hasn't, and I should be clarify here that, the models I was reviewing to you, some of those are what I have done before, and then some of those are not. They're just, kind of like summarize what's in the area. So I definitely think that, like game theory models, in fact, I show you a snapshot of this interdiction model. We talk about these sequential game that you can think about, but then there's also some sort of like Nash equilibrium and stuff like that. You can be done here as well. So like we can like maybe talk offline or by email to talk about more specific context that we can apply this in-person game to fight COVID-19. But I also know that there's a lot of like CS research being done in terms of studying kind of like social behavior, how people cooperate with the order of stay home, and then this basically can be modeled as game as well. Yeah. So there is another question about, is there any model for distributing medication, medication trials, and so on and so forth. So I know that there is a lot of research being done in terms of the drug supply chain management. So not only for COVID-19, just the FDA drugs, like how do you kind of like distribute them to different channels, and that's kind of like a supply chain question. And actually, I have colleagues in my department who is expert of that. I can direct you some papers that they wrote. These days, I think one of the interesting questions I heard is the repurposing of some of the drugs. So it's very time consuming waiting for some drugs to get FDA approved for just COVID-19. But then you do have some other drugs getting taking some effects, and people have statistics about showing their performance, right? So then, the question is, how can you take combination of the drugs that already been proved for other type of disease to treat some of the COVID-19 cases? That's something people have been talking about, and that can use some models behind it. So models that depend on data, there are concerns about data quality and lack of transparency and coordination between governments. How can data science community tackle these issues? And I think that's an excellent question. And I didn't, kind of like dive into the deeper about, these different models, what their like new status are, because the models I show you are very traditional old models. But the question here is like the parameters we need in these models, right? We often assume if you take any classes, most of the, kind of undergraduate classes will tell you, we give you these parameters. We let you know what the costs are, what the demand are, and so on and so forth. You plug into your model and you can solve it. There is a big research area in optimization called stochastic optimization and robust optimization are dealing with the issues that you don't know the parameters. And in this case, if you don't know the data can be completely trusted, what you can do is basically you can think about, it may follow a certain distribution, but you don't really know the information of that distribution exactly. So it won't be just for sure normal distribution and so on and so forth. So something that you can do from the modeling side to get a better solution is to do something we call the, sort of like a distributionally robust optimization or stochastic optimization. So you have to make decisions under the uncertainty, and with respect to all kinds of possibilities that the data could be, the true data could be, and then you basically minimize the regret or something like that. So that will be some sort of like way the modeling side can handle. The other ones that you can think about is you can make your model and the data collection process iterative process. So meaning that some part of your model is actually decision dependent. And that's an example in testing case, because if I test this region, then I know how many people get infected in this region. And then I will use this data to get prediction. But if I don't test this region, I wouldn't know, right? So some of the application is like this feature, like oil, exploration. Like you have to make an action in order to observe the data. And then so the action you make come from a model that take the data, but then that data can be modeled as a function of your decision. So that's something that you can also think about using something we call decision-dependent uncertainty to model the problem. Thank you. Can you say a few model predictions and it's authentic about tech doctor? So I'm sorry, so I'm not an expert of the telemedicine thing. I think so when you say model predictions, I would think that you want to predict like how many demand we may see in terms of people who need a doctor online. And that part, I think that data can be pretty trusted. Like you have a historical data, people going to hospitals and how often they need to go, like for those chronic disease patients. And you can use those to predict the demand. For the model itself, it's just sort of like some scheduling problem we often do. You have doctors who can do this time. You have patients who need these kind of doctors. How do you pair them together and then make it work? So that's some scheduling problem. And again, you can send me an email and I can send you some papers on that. Okay, so I think we're about the time, and thanks everyone for asking the question, and thank you.
Yeah, thank you very much, Professor Shen. This was a very nice kickoff to the series, and everybody please tune in next week, Wednesday at 12:30 for the second talk in this series by Professor Brahman Mukherjee of Biostatistics.